Good morning, everybody. Thank you for that. Yes, my name is Tracy Mckenzie. I work with the New Zealand branch of the New Zealand Prostitutes Collective, and I'm the South Island Community Liaison. Some of you in the audience will know that NZPC has been around for several decades. In fact, we're turning 30 next month, and of course sex work has changed a lot in that time, and it continues to change. Now let me just...
Where do you point that thing to make it work? Oh, the other way.
Sorry? Ah. Right, so where am I? Sorry. Go back to the beginning. Here we are, sorry about that. Okay, the New Zealand Prostitutes Collective is based on the idea of sex workers being experts in their own lives. So our organisation is sex worker led and focused around community empowerment. We work with communities of sex workers across the country, the majority of whom are women, and we also have significant populations of men and gender minorities. We provide sex worker-led outreach where people with deep knowledge of sex work share information about behaviours and strategies to keep safe. NZPC has sometimes been called a collective of collectives. We have branches in 5 main cities and we adapt to the local needs and contexts. We promote a human rights framework and we also work on shaping policy to create enabling environments. These are key aspects of our work, ensuring sex workers' needs are met in the context of sex work. These are all fancy words, and I'll tell you a bit more on the next slide. I want to address today sex workers that work indoors in particular. They often work in managed brothels or for themselves. Of course, NZPC works with people of all genders, but today I'll be primarily talking about women. Independent and managed workers. Most sex workers consider themselves to be independent contractors, and we estimate about 40% of sex workers are working in managed brothels. These were once known as massage parlours, some people may remember. And while the remainder are working independently for themselves. So what happens when a sex worker starts out today? Sometimes she has a friend who may have talked to her about the wonders of sex work, or she may have been thinking about it for some time and is curious. She'll probably look online and find out what information exists, and no doubt will come across some very dubious information. She'll also see lots of advertising websites and brothels that are marketing sex workers to clients. Hopefully she'll discover the NZPC website and get in touch with us. Sometimes she'll go for an interview at a brothel and they will refer her to us for independent support and information and ways of which to work. Or the brothel will sometimes suggest she has a sexual health checkup, which we can provide at our community centres in Auckland, Christchurch and Wellington, and we thank Sexual Health Auckland, Wellington and Christchurch for that, and Family Planning in Wellington as well. It is important that we intersect with new sex workers as soon as possible so we can provide them with accurate and appropriate information and support. Most indoor sex workers are advertising online these days, and it's important to appreciate that some of the pressures that sex workers experience when they first start out. Critical decisions have to be made, not only obvious ones like how long they want to be available, what hours they'll work, but also about what image will go upon the advertising sites and what sexual services they feel comfortable providing. This is sometimes hard to do in front of a brothel operator who is very keen to get the sex worker started in case she decides to work at a competing brothel. The sex worker might also feel pressured to provide more services than she otherwise would feel comfortable with in order to secure a place in a brothel that she thinks may be desirable to work at. Ideally, NZPC collaborates with new sex workers to slow this process down, giving them more time to absorb the information and make informed decisions about what is best for them at the time. It used to be that most sex workers would meet on the street or in massage parlours and people work together. Those who were more experienced would show the newer and younger workers the ropes with mixed results. Things that might sound obvious, like using a condom and water-based lube, are not necessarily obvious to someone new in sex work, and how to negotiate safer sex with a client who is hell-bent on pushing the boundaries is an important skill to learn. So at NZPC, we labour on how to push back against these pressures. Now, more and more people are starting up individually, and while this gives a sex worker a lot of independence, it can also cut them off from the community and sharing knowledge and tools for the practical realities of sex work, making that early contact with NZPC even more crucial. As I mentioned, most sex workers these days are advertising online, and there are various platforms, both paid and free. Some websites provide functions for sex workers to be reviewed by the clients that see them. This means that for the first time in sex work history, clients are able to communicate with each other in unlimited numbers and exchange information about their experiences with individual sex workers. One of the major online advertising platforms in New Zealand has set up a forum enabling clients to leave detailed reviews, and while a good review can create opportunities for more work, which of course most sex workers want, a bad review can equally cause harm. This can give clients more power, and so sex workers have to navigate this. Social media and privacy, it's very important. These are real issues, and I'm sure you're familiar with the need for privacy. Sex workers need to make sure the cell phone and or the email address that they use is not connected to any of their personal social media profiles, or they could be outed as sex workers. And while sex work is decriminalised, there are still huge issues around acceptability. Stigma and discrimination directly impact the sexual and reproductive health and the rights of sex workers, as we all know. It can stop a sex worker from disclosing details about their sex work or from talking to you at all as health professionals. However, we're very happy to report that it's our impression that more and more sex workers are feeling comfortable disclosing their worker status to their healthcare providers. There are now a significant number of sex workers who are travelling around the country. This is known as touring. Some touring sex workers are permanently on the road, working and living mostly from motels with no permanent address. They connect with us and we send them safe sex supplies, or they drop into our branches to collect them. However, we're aware that many of them may be completely isolated and disconnected without any community support systems. So we trawl through the adverts on the websites and sometimes in the newspapers too to reach out to these workers. Some of these touring sex workers are travelling from overseas, as has been previously mentioned. This work is illegal due to immigration laws that forbid sex work for migrants. This affects how likely they are to contact health services, as they are concerned that they may be dobbed in. However, we work with these people and support them in this situation. Advertising online does bring some visibility. It makes our role at the NZPC a lot easier in terms of accessing sex workers. We can read these websites and pick up a tremendous amount of information at a glance. We can usually see the services that they're providing and whether or not they're working safely or not. For example, premium service or GFE or BBBJ may mean nothing to you, but to us it reveals the way a sex worker is practicing. For instance, GFE stands for girlfriend experience. This term usually means a more intimate experience with the client, but we encourage sex workers to never compromise safety, even if they are marketing intimacy. Seeing this allows us to reach out to sex workers and talk to them in a realistic manner about some of the risks involved with these practices. These are some of the resources that we have, that we send out to people with their packs of condoms and things like that. Thank you. Stepping forward, this is a comprehensive guide for new and experienced workers, and the Doing It in Style is a general guide for transgendered workers, and we're currently updating our resources for men. Now, of course, we work on violence prevention strategies for sex workers. The right to say no is paramount. It's been touched on before too. Safety apps are being developed, and in Christchurch we have a system that we call Protex, which involves a bulk texting alert system designed to inform sex workers about dangerous clients or people, and they can also contact us through that as well. Another one of our posters. This is very important. It's our right to say yes, our right to say no. Family Planning, Public Health and a number of other agencies collaborated with NZPC to develop this poster for display in brothels. I think you saw this one before, but this was produced by the Ministry of Health, and it's usually on display in a prominent position in most brothels. It says that clients, brothel operators and sex workers must all take reasonable steps to ensure condom use, etc. Now, some of you may have seen we have a display out in the exhibit area with several posters, and one of them is this one here, which was developed by us with sex workers and brothel operators to help uphold labour rights and workplace safety. And I think that's about it. So hopefully I've covered everything. Has anybody got any questions?
Any questions? I have one question.
Yes.
I work at the NZPC in Auckland,
Yes.
and have found it absolutely invaluable with a new sex worker having the opportunity to speak to a peer, and they just come back so empowered. It's like they're 3 inches taller without their heels. What about people that are in areas where it's not part of your collective of collectives? If you're a clinician working in that area and dealing with a sex worker, how would they connect with NZPC to get that fabulous peer support? And,
Right.
Yeah.
Well, several ways, and as mentioned, since people have been advertising online, that has made things a lot easier for us. We do trawl through these ads, and we actually have someone dedicated in the North Island that goes through the ads as well, looking for new people, and we can contact them directly. We also do rely on health providers in the regions. This is what you
in the
mean?
regions,
Yes.
yeah.
Yes, to tell us about new workers that may have disclosed to them. We take a very, gently approach. Sometimes people could be a bit confronted by suddenly rung up by the Prostitutes Collective. So we just offer our services. Usually, first thing we can do is send them a package of discreetly packaged things, and they usually really enjoy that, and throw in a few treats and things like that. My particular catchment area goes from Timaru right up to Nelson and Blenheim, and we try and travel around that area as much as we're able to, but nowadays with cell phones, texting, email, it's a lot easier to keep in contact with people. But you're right, sometimes we will come across people that haven't heard of NZPC, and usually it's very nice to hear that they're thrilled to hear about the organisation, and
Yeah.
yes, so thank you.
Thank you. Thank you very much.